Today we will be performing a lung assessment.
Hi there, my name's Amy. I'm going to be your nurse today. Can you tell me your name and date of birth?
My name is Charlotte and my date of birth is 7/2/77.
Thank you. So I'm just going to wash my hands real quick. So while I'm doing that, I'm going to inspect my patient for appearance, posture, and breathing effort. So she has unlabored breathing. It's not labored. She's not sitting in a tripod position like this. She's sitting upright. No pursed lip breathing, and she's not using her accessory muscles. Next, I'm going to palpate your trachea with my thumb, so you're just going to feel me touch your neck. So I want to see that it's midline and it's slightly movable, her trachea. Next, I'm going to count her respirations. This part we should already know from vital signs. So without telling her, I'm going to count for 30 seconds, have a number, and then multiply by 2. And that was 7. So 7 times 2 is 14. So that's within our normal range of 12 to 20. Next, I'm going to do her O2 saturation. And with this, I'm going to use my pulse ox. Can you place your finger like this? So first, I'm going to check her cap refill. And I would say it was normal. It was less than 3 seconds. Turn on my pulse ox. Put it on her finger. And I'm making sure I have a good waveform before I read that number aloud. And we are at 98%. So that is normal. So normal is greater than 95%. But if she had COPD, we would expect a lower number for her pulse ox. Next, I'm going to observe the breathing pattern and chest expansion. So as I'm looking at her, I can see it's quiet, effortless, and even, and she's not using any of those abdominal muscles. Next, I'm going to inspect her nails for color. So when I look at them, I can see they're pink. There's no yellow. If they were yellow, it might be because she smoked cigarettes. They aren't pale or any pallor, no cyanosis, so no blue. I've already checked cap refill on that hand, but I would check the other one too. And everywhere is less than 3 seconds. Then I would have her do the Shamrock window test. So for this, can you hold your fingers like this? So I'm looking for that little diamond right there, and I see it. So that says she does not have any clubbing. Next, I inspect her skin and lips for color, and it's pink overall. It matches. There's no signs of bruising. Maybe a little rosacea going on because her cheeks are a little rosy today. Next, I want to inspect the posterior thorax for shape, symmetry, and muscle development. So for this, could I have you please stand up? So I'm looking at the back of you first. So if I could have you turn, very good. So as I'm looking at her, I want to see her ribs slope down at 45 degrees relative to the spine, that her spinous process is midline and straight. Her scapula should be symmetric bilaterally, and they are. And then I'm also looking at muscle development to make sure it is equal. Then we will move on to palpating the posterior thoracic muscles for tenderness and symmetry. So for this, I'm just making sure they're equal, and I'm just going to ask if she has any tenderness if I move down. Any tenderness you're feeling?
No.
Good. Next, I'm going to palpate the posterior thorax walls for vocal or tactile primitus. So with this, I'm going to place my hands on your back, and for this, you're going to say 99. And I want to feel vibrations. If I do not feel any vibrations, there is decreased air movement. So I'm going to have you say 99.
99. 99. 99. 99.
Good. And I felt vibrations with all of those. Next, I'm going to palpate the posterior thoracic wall for thoracic expansion. And for this, I'm going to place my thumbs on the side of her spine. Then I'm going to have her take a deep breath. And with that, I saw a lateral movement on my hands. So if you couldn't see that, it went up just a smidge and came back in. Next, I'm going to auscultate the posterior and lateral thoraxes for breath sounds. For this, You want to make sure you're using the diaphragm of your stethoscope, so make sure you've already cleaned it off. And for this, you will want to go on their skin, but due to privacy reasons, we're going to do it on our clothes for this assessment. So I'm going to put the stethoscope on your back on 8 different locations, and I'm going to have you take a deep breath, and then I will move. And when I move, I'm moving in a mirrored fashion so that I can compare her left and right. So take a deep breath for me. Deep breath. Deep breath. Good. Deep breath. Deep breath. Deep breath. Deep breath. And one more. Good job. Deep breath. So that was clear on the posterior. Now I'm going to do her lateral lobes. So with this, I'm going to do 2. So one on the top and one on the bottom on each side. And again, I'm going to go mirror image. Take a deep breath. Another one. One more. And the last one. Very good. So again, I heard all clear lung sounds, but you might hear things such as crackles, wheeze, or rhonchi, and those are abnormal lung sounds. So next I'm going to have you sit back on the table, and then we're going to inspect the anterior thoracic for shape, symmetry, muscle development, and the costal angle. So again, everything we did on the back, we're going to do again on the front. So her ribs, we want to have them slope down at a 45-degree angle relative to the spine. Muscle development, we want to make sure that's equal. Her costal angle is less than 90 degrees. So next I'm going to inspect the anterior thorax for anterior posterior to lateral diameter. So this should be a 1-to-2 ratio is expected. So if I look at the side, then I create that angle and put it on the back, it should be half of her back. So that is a normal finding. Versus if my hands were out here and I filled her whole back, that would be a sign of a barrel chest. So now we're going to palpate the anterior thoracic muscles for tenderness and symmetry. So I'm going to not invade her privacy again and just do it on the top. So any tenderness you're feeling?
No.
Good. So now I'm going to palpate the anterior thoracic wall for vocal fremidus, and for this I'm just going to do on the top, but again you would want to do them with all of them. Can you say 99?
99.
Very good. So again, I felt the vibrations, and that is a normal finding. If I did not feel those vibrations, there would be decreased air movement. So for this one, for the thoracic expansion, we would do it just under her breast, but again, we're looking at her, thinking about her privacy, so I would just have her take a deep breath, and your hands would go lateral. But we're going to just verbalize that on the front and not actually touch on the front. Lastly, we're going to auscultate the anterior thoracic wall for breath sounds. And again, we want to make sure it's clear and that we're not hearing any abnormal sounds such as crackles, wheeze, or rhonchi. So for this, I'm going to do about 6 to 8 on the front. Deep breath. Very good. And that completes our lung assessment.